In Africa, for the past 20 years, most of us have been using artemether-lumefantrine to treat malaria. Artemether-lumefantrine, also known as ALU or Coartem, has served us very well during this period and has been highly efficacious for almost all malaria cases. This is changing, and it's important that we prepare. We are all very used to having a first-line antimalarial drug. This will change, and we will soon have several first-line antimalarial drugs, not just one. Some of these changes will be happening soon. What does this mean? Let's summarize in a few key points. Number 1, the antimalarial drug that we use might change every year or every 2 years. This means that this year, you may be stocking and prescribing one artemisinin combination therapy, or ACT, but in 2 years, you may be prescribing a different ACT. Different ACTs may also be recommended for different regions of the same country or different age groups in the same region or country. So it will be important to stay up to date with the National Malaria Control Program's recommendations. You should check the national recommendations regularly and also take part in discussions through different platforms, such as online groups of experts, colleagues, and implementers. This will enable you to stay updated about the changes in treatment guidelines and other relevant recommendations from the National Malaria Control Program. Number 2, inventory and stock management is now going to take more effort. We will all have to keep up with the national recommendations and know which drugs we currently have in store. And we're going to have to do more planning and timely forecasting on what drugs to order. We'll have to remember to order early, as drug orders sometimes arrive late. Number 3, we will always have to be mindful of appropriate dosage. When drugs change, weight bands change, and we will always need to remember to look up the correct dosage for a patient's weight. Keep all your posters up on the walls. There may be 3 or 4 new antimalarial drugs introduced over the next 5 years. Number 4, talk to your community and talk to patients about these changes. They will have lots of questions, and they will rely on you to reassure them that this is all part of our new approach to fighting malaria. Let them know early, let them know ahead of time, and tell them to spread the word to their friends and family. Why are we making these changes? The answer is drug resistance. Africa has had several waves of antimalarial drug resistance over the past 50 years, and a new one has arrived. Some of us remember how untreatable malaria was in the 1980s and 1990s. We are not going back to those times. We are preparing for this next wave of drug resistance by making sure the malaria parasite has many different drugs to fight. Our goal is to prevent drug resistance from becoming widespread. Is this approach strange or unusual? No. We're simply modernizing our public health systems to fight new threats. The best way to stay informed and to ask questions is directly through the website of the National Malaria Control Program or through colleagues working at the national program.